Hey guys, this is Dr. Jason Shumard with Integrative Wellness Center of San Diego and also the author of How to Reverse Your Diabetes. So today I wanted to talk about a very important topic, something that we come across in our office every single day when we're having conversations with prospective practice members. And that is, are you currently managing your diabetes or are you working on reversing your diabetes? And many people would say, well, isn't that the same thing? In actuality, it's not. We have to define that. And so when the current model that most people are doing in regards to their diabetes is they're trying to manage their diabetic condition. So what does that mean when we talk about managing? So essentially, managing is going to focus on a couple of things. So we're going to focus on trying to decrease blood sugars. Right? The whole focus on when we're trying to manage your diabetes is what can we do to bring down your blood sugars? So some of the common things that you guys are doing is you're exercising. You're being told, listen, if you exercise on a regular basis, what's going to happen is that it's going to help burn your sugars, it's going to help keep your sugars down, and it's going to help manage your diabetic condition. You're being told to diet, right? Maybe that might be consisting of less sugar, less carbohydrates, increasing proteins, those sort of things, is staying away from the candy, the cookies, the sodas, the juices, all those things that people love, but you're focused on trying to eat a certain way to lower your blood sugars. And of course, you are trying to decrease your weight. In many cases, there's individuals, especially with diabetes, they may have a little more weight, they may have some additional areas around the pounds are in the belly area here that they need to lose weight, and they're being told that if you just lose the weight, that's going to help lower your blood sugars. And of course, they're going to take their medications. The medications you're currently taking, things like metformin, glipizide, glimepiride, glyburide, insulin, Invokana, Lantus, whatever it is you're taking, the focus is to lower the blood sugars. Now, what's interesting is that when we focus completely on blood sugars, what happens over time for most individuals? Well, typically, when you're focusing on just blood sugars alone, eventually the medications are going to increase, or you're going to have additional medications. And the reason for that is because the focus is trying to lower the blood sugars. So when things aren't going the right way, and your blood sugars start to rise, your hemoglobin A1C starts to rise, the only option that you have is to take more medications and to continue focusing on this. So this, in a management situation, is basically going to be what your treatment is going to look like for the rest of your life. You need to exercise, lose weight, change your diets, take your medications, or increase medications. This is essentially what the whole treatment plan is going to look like for the remainder of your life when you're dealing with diabetes. Now, there's going to be some people that are going to do an amazing job, and they're going to be able to get off the medications, they get their diabetes under control, and they no longer need that medication. But for a majority, I'm talking about 95% plus, maybe even more, this process will just potentially try to slow down the progression. So our goal in this situation, with this whole protocol here, this treatment, the goal is to try to decrease progression, to slow down the progression. And this is what's pretty much the extent of the treatment that's currently going on in the traditional model, in the drug therapy model. We're trying to slow down, we're going to manage your diabetic condition so we can try to slow down the progression and try to reduce the timeline eventually it'll take. And for most people, unfortunately, that are dealing with this and they're trying to manage it, they have an increased risk of an early death. It's just the reality that this is the trying to slow down the progression of the early death, because we know diabetes increases the risk of things like cardiovascular problems, heart attack, stroke, kidney disease, neuropathy that can lead to amputations, amongst other things like type 3 diabetes, which is Alzheimer's disease. I mean, there's so many things that can increase the risk of an early death of a diabetic because blood sugar function is so important to the body, it impacts every single system inside your body. So this is what managing looks like. The focus is trying to keep your blood sugars down. By doing that, you can exercise, diet, lose weight, take your medications to try to slow down the progression of the disease. But unfortunately, as for most people, the progression continues. So the only option is to increase medications and continually doing the same thing to try to slow down the early death. Now, the alternative is, as I mentioned at the beginning of this, so that's considered managing. The alternative is reversing. So what is reversing? What does that specifically mean? So let's go over that and talk about some differences. Now with reversing, this is a whole different ballgame. This is a whole different mindset, and really a whole different protocol is necessary to achieve the results. Because in reversing, what the goal is, do the goal down here, the goal is not to slow down the progression, not to try to reduce an early death only, but essentially become non-diabetic. That's really the goal when we're talking about reversing. So what does reversing mean? Reversing means taking an individual who has diabetes and put them in a situation, put them into a body, if you will, that's no longer showing any diabetic problems, right? They're off their medications, reduced or off medications. They're having normal blood sugars, normal hemoglobin A1C. Their risk factors are decreasing and getting better. And the way that we get from here to here, so to link these two together, is a specific protocol. What that means is we have to understand what the cause is. So what is causing their diabetes? And I can tell you right now, blood sugars is not the cause. Your elevated blood sugars is not the cause of your diabetes. The elevated blood sugars is a symptom of your diabetes. Just like if you had a bacterial infection, a virus. What are some of the symptoms you're going to have? Maybe a sore throat, runny nose, headache, maybe a fever, just feeling overall fatigued. All you want to do is sleep. You don't want to eat. You have no appetite. These are all symptoms of the infection. Well, blood sugars going up is nothing more than a symptom of your diabetic condition. So if your blood sugars are not the cause, then what is the cause? And that is the key component to this whole process of trying to reverse this, is you have to comprehensively test to determine what the cause is. See, right now, for most individuals who are suffering with diabetes, the type of testing that's being ran in the traditional model is very specific to what needs to be medicated. Meaning, so if we test for elevated blood sugars, well, there's a pharmaceutical drug that can treat the blood sugars. If you have elevated cholesterol, we've got a pharmaceutical drug for cholesterol, blood pressure, and so on. So most of the testing that's being done is focused on trying to give you the right medication to address the problem, which is the symptom, essentially. So when this scenario is, we want to test someone very comprehensively to find out what is causing their specific diabetic condition. So what does that mean? That means literally grabbing them by the ankles and shaking them out to see what comes out of their pockets. Really testing everything. So when we do comprehensive testing, we do a full blood workup on somebody, not just your basic panel, but I mean a full comprehensive blood workup. For most of our patients, depending on the lab we're sending them to, it can be somewhere between 9 and 11 vials of blood. I mean, it's extensive comprehensive testing. We do comprehensive hormone analysis, looking at the expanded female and male hormone panel. We do adrenal analysis. We look at biotoxins or toxicities, heavy metal toxicities. We look at immunological type things, genetics. I mean, we look at the full gamut of what's really going on with the individual. Now, of course, not every single person is going to need all those tests, but what I'm trying to give you is the extensiveness that needs to be done when you're looking for the cause. So when you're looking to try to find out how to reverse your diabetes, if you're going to be continually doing the same things, right? Changing your diet, exercise, lose weight, take your medication, and expecting to find out what's causing your diabetes to help you reverse it, It's never going to happen. Now, of course, I shouldn't say never, right? Even a blind squirrel can find a nut sometimes. It can happen with some individuals. Maybe they find the right key. Maybe they find the right tools that is going to help them achieve that goal. But for a majority of individuals dealing with diabetes, it's not going to be the case. They need this comprehensive analysis. They need to find out exactly what's going on so then a customized solution. That's the another component here. The other component is once you find the cause, you have to customize the solution. So that means that every single person that has diabetes, their cause is going to be different. It's going to be unique to them. So if we can find out what's specifically causing your diabetes, we can then put a customized solution together. This is our proven three-step process, right? The first step is the discovery. What is specifically causing your diabetes? What testing have you ran? And we need to disseminate that information. Once we have that information, then we can move it into step 2, which is the customization. The customization is important to optimize the body. See, at one time in your life, you were able to regulate your own blood sugars. You were able to go out and eat the pizza, the cake, the pie, whatever it was you wanted to eat, and the next day you had normal blood sugars. But now you can't. So something must be broken that's going on there. And once we get that discovery process understood, it's very simple to put a customized program together. And so once you optimize everything and you get to the point where you get the person to non-diabetic state, then you can help them maintain it, which is our third step. What type of lifestyle do they need to continue to live? What type of food do they need to be eating? What do they need to maintain it with? Do they need to take certain supplements or minerals or herbs or nutraceuticals to help them support their body's needs to stay in this place so then they can live the quality of life, so then you can live the quality of life that you deserve. So you really have two choices. You can continue managing your diabetes and hope and pray that you have that longevity and quality of life for as long as possible to spend with your life and loved ones, or you can move into something else, which is reversing. Now you have to look outside the box.